Hello, everybody, and welcome to today's presentation of 8 great websites for your health. Our presenter today is going to be Martha Sullivan. We are going to get started in just 1 minute, but first I do have a couple of housekeeping announcements. We are going to be holding any questions we have until the end of the presentation. However, at any point in the presentation, you can use either the Q&A button or the chat to submit any questions that you have. When I stop talking and Martha begins presenting, I am going to share today's handout in the chat, and I will post it again at the end of our presentation before we do the Q&A. At the end of today's presentation, there will be a survey available to you. Please do complete this because we do use your feedback in planning any of our future webinars. There is a website where you can go for health-related resources, including information about COVID-19. This is Martha's Health Sciences LibGuide. And you can see the address is below on the screen. Again, I am going to post this link in the chat once we get started. And again, I will post it at the end right before we do the Q&A. Before Martha begins her presentation, I would just briefly like to go over the Zoom dashboard and what you'll be seeing. So this is what you should see in your settings. On the left center of your screen, you'll see that there is a chat button. On the right center, there is a Q&A button. You can use either of these functions to post any questions. And then if you are having any technical difficulties, you can use the center button, the raise hand button, and I will send you a private chat and see if I can help fix whatever is going on. So with that, Martha, please take us away. I am very excited to hear your presentation today.
Thank you so much, Regina. And thank you everyone for joining us today for our discussion of at least 8 great websites for health. As Regina said, I'm Martha Sullivan, one of the reference librarians here. And one of the things I do is maintain our health research guides. So I'm always looking for trustworthy, helpful, high quality health websites to share. As Regina mentioned, there is a handout with all the websites listed. So in case you need to log out early for any reason, you will have that. And I'll probably be mentioning over the course of the webinar more than 8 websites. And the blog post that we send out later with the summary will include any sites mentioned. So a Pew study from about 10 years ago found that 59% of internet users looked for health information online. And a more recent study from 2021 found that 2/3 of Americans trust the health information they find online. So this does appear to indicate that many of us use and trust internet sources for health questions. So it's very beneficial to know some key trustworthy medical websites. And in addition, it's important to evaluate the type of information and websites we find. Often we're just going to Google, putting in our search terms. And when we get those results, it's good to have a tool to determine as much as we can the reliability of those sites. So one easy to use tool we can use when checking quality and objective reliability of a website is known as the CRAP test. This is a tool developed by librarians, and it's used when librarians instruct people on using health websites what to check for. So this is a quick summary, just a reminder to have sort of in the back of your mind when you're looking at your health websites. So currency, when was the site last updated? You usually don't want a health website that's out of date. Relevance, is the site relevant to what you're searching for? Who is the intended audience? Is it the right level for your needs? Authority, who is the source or author or publisher of the site? Are the credentials readily available, and do they provide the contact information? And what does the URL reveal about the source? Is it a .com, a .org, a .gov? A .com, as we know, is a commercial site, so it may have some advertising, it may be selling something. So you might want to use a little bit more of a critical eye. So for example, is advertising on the site labeled? Then accuracy, does the information seem biased? Can it be verified by other sources? And some obvious things like, are you seeing a lot of typos? And finally, purpose. Does the site state its objectives? Is it there to inform or entertain or persuade or to sell something? And one, example of a red flag on a site might be a site selling something that they say is a cure, a treatment that is a cure. That's something to be very skeptical about. And it's always important to verify health information you find online with your own healthcare provider. And of course, none of these websites should take the place of meeting with your own healthcare provider about questions you have. So let's get into the websites. And I'm going to spend a couple of minutes on each site, going over them pretty quickly. There's more to be found on each one if you wish to delve further. And as Regina said, I can take some questions at the end. So we're going to start at the New Jersey State Library's website, which is njstatelib.org. And first, we're going to look at a couple of resources for finding doctors and some information about those doctors. It can be difficult to find detailed information about doctors online beyond information that's to be found sometimes on the medical office's website. So there's a couple of resources where you can find some general and objective information on doctors that could help provide some guidance. And the sites I'm mentioning are not rating sites. They're just resources with general factual information. And the first one I'm going to talk about, it's actually not a website, but a database. And it's a New Jersey statewide database called Reference Solutions. It used to be called Reference USA, if you're familiar with that. And it's a good place to search for doctors for a particular specialty. And I'm including it in this list because it is a New Jersey statewide database. So everyone in New Jersey should have access to this through JerseyClicks or your local public library's website. And you'll see the link on the handout goes to jerseyclicks.org. And that's where you'll find the listing of statewide databases. You can also find the link on our website under the Services for Libraries drop-down menu and go to JerseyClicks. And this is a listing. If we click on View Databases, this is a list of all the statewide databases. So I'm going to scroll down and look for Reference Solutions and click on Access Database. And Reference Solutions is a great resource. It has business and residential directories for the US and Canada, and people use it frequently for business research. But we're going to be using the US healthcare section with information about doctors and dentists to find doctors in a particular specialty. So when you go in, you'll see that there's two tabs, a quick search and an advanced search. So if you already know the name of a doctor, you can enter it here. But we're going to search by certain criteria. So I'm going to click on the advanced search tab. And when you do that, it opens up this column on the left with all the different criteria that you can search for. So information about the doctor, geography, and practice and credential information. So let's say I'm looking for an allergy physician in my county. So I could select the county box, the primary specialty box, and let's say I want the doctor to be board certified. I can select that. So you can see every time we make a selection, a box pops open in the middle of the page where you can now make those choices. So I'm going to select New Jersey, and then I can select a county. So I'm going to select Hunterdon, and then we'll come down to the primary specialty box. And you can see there are a lot to choose from, both for dentists, and physicians. So one thing you can do is you can start typing in the box and it'll pull up the term that you're looking for. So I'm going to choose allergy and immunology. And when you make the selections, they appear in the selection boxes. And for board certification, I'm just going to select yes. So at this point, I can take a look at how many doctors fit this criteria by clicking on this update count, this blue button, update count. And this shows there's 2 doctors that fell into that criteria. I'm just going to go ahead and add another county in here. I'm going to add Mercer and click on update count again, just to get a few more options to choose from. And now I'm going to click on view results. So from here, we have our list of results. You can now look at entries for the doctors. So I'll look at this first entry. And typically what you're going to find is information like their medical school, their age, and information about their office. Sometimes it'll show if they accept Medicaid and Medicare. Now, some of the entries that you'll see in here, you might see a lot of things that say not available. It's possible that some of the offices haven't provided the information for the database to enter. So you might see different levels of information in this site, but it kind of gives you some information. So we could go back, we could take a look at another doctor. We just click him. And then here's another doctor. You see the medical school isn't available for this entry, but there's other information available. So, and from here, I could go back, I could select the doctors I've chosen. I can print or download a list for myself. So that's primarily what I use this database for, searching for physicians in particular fields. The other site with information about doctors is one that's specific to New Jersey, and it's called the New Jersey Healthcare Profile. So I'm going to go out of there. And at this point, I'm going to go to our health research guide as a starting point to find all the other websites we're going to be talking about. So under the research library drop-down box, you'll see a link for our research guides. And there's a lot of research guides here. They're all great. They're on lots of different topics. If you're looking for information about legal resources or business and company research, there's a great genealogy research guide. These are all excellent starting points and answer many questions. But I'm going to choose the Health and Medical Resources research guide. And here's the front page. You see we show some new books and ebooks in the collection. But I'm going to go to the tab that says selected websites. And for the doctor information website, there's a tab for doctors and hospitals. So I'm just going to scroll down and look for the New Jersey Healthcare Profile link. Now, once you come in here, you'll see it says .com on the top. It actually is a state government website. This is from the Division of Consumer Affairs. And if we go to the About Us page, you'll see information about the statute that requires that profile information about physicians and podiatrists and optometrists be developed and made available to the public. And you can see that there's some required information and also some optional information that goes into this site. So when you do a search, some entries will have more information than others, just depending on what they've provided. So if you're back at the main screen, there's a box where you can search right away for your doctor's name, or you could go to the additional search options at the bottom, or you could go to the Find a Healthcare Professional link at the top. And from here, we can enter the name of a doctor we have. We can also search by a field of practice and a county. I usually go in and enter a name that I'm looking for. Let's try the first person we saw in Reference Solutions. He's a physician, and we'll click on search. And it looks like this first entry is the one we want. So this first page about the physician will show that their license is, if it's active or not, when they got their license number. And then there's 4 tabs of information about the doctor. So if you're interested in just medical school, you can open just that section, or you can expand the whole page and look at all the information that's available. Like I said, not everything will have an entry, but it's usually pretty good to find information that you can't find elsewhere. Under the practice information section, there's the offices, sometimes there's the health plans. I really like this languages other than English spoken by the practitioner. Sometimes I'll see something entered there. I wish that was a searchable field, but it isn't. But I'm always happy when somebody reports that information. Hospital privileges are shown at the end. The next tab is for legal actions. So you can expand this and look and see if there's any disciplinary actions, any out-of-state disciplinary actions, criminal convictions. There's no criminal convictions reported for this practitioner. It's always good. Medical malpractice within the most recent 5 years. So this will show if there's any malpractice payments for this practitioner. It's a little off center. You can see there's 0 for this one. This is showing the number of doctors in this specialty. So out of this 459 doctors that had a malpractice payment. And just something to be aware of, there's information down here that says that these settlements could happen for a variety of reasons and may not reflect negatively on the professional competence or conduct of the practitioner. So just something to be aware of when you look at that information. And then professional activities. Not everybody has something here, but this physician does. He has a medical school faculty appointment. So that is the healthcare profile. One thing I do want to say about it is that you can search by field of practice and county here. There are a few fields of practice that are missing. I don't see cardiology or gastroenterology, for example. So just something to be aware of. I typically will get a name either from searching online and going to reference solutions, and then coming here and looking that name up in the healthcare professional, the New Jersey healthcare professional database. Okay, so, and then also on this page, you'll see other websites that can be helpful. We've got a link to the top doctors and top dentists from New Jersey Monthly. These do have some ratings, or what it is, it's a survey of the top rated doctors, and it's not selected by the patients, but by their peers, by other doctors, who other doctors chose. There's also a link for find and compare providers from Medicare.gov. This is another place where you can come in and look for information about doctors and other services. It's good in that you can compare multiple practitioners and kind of look at that at the same time in columns. It generally has the same information that the websites we were just looking at, but it has that comparison view. Okay, so next we're going to take a look at resources for drug information. So I'm going to go to the drug information tab. And originally, actually, I was going to show the link for the drug information portal from the National Library of Medicine. It's a great website. However, I found out a couple of weeks ago that it's going to be discontinued by the end of the year. I believe the National Library of Medicine is consolidating a lot of their resources. So this one links to a lot of other NLM databases. So I guess they figured you can find that information in those other databases or those other websites. So instead, we're going to take a look at DailyMed. And this is another resource from the National Library of Medicine. This provides the most recent labeling submitted to the FDA by companies and currently in use. And it contains labeling for prescription and non-prescription drugs, and for human and animal drugs. So you can see up here, you can search for just human drugs or just animal drugs. And it is geared toward health professionals. So it would be good for doctors, for pharmacists, pharmacy technicians. But there is information here that could help consumers. And some consumers do want that extra level of information. So I'll just show you how the type of information it provides. I'll look for Eliquis. And we get multiple records. There are multiple packagers for the drug. And you can hover over and take a look at the packaging details. Once you select the medication, it opens up this page with lots of different detailed information about the drug. And if there is a box warning, it'll be open automatically. The box warnings are required by the FDA if there's any risk of adverse effects. So one thing you can do here is if you want a consumer or patient version, you can click on this and go to this version of the page. I find that it's almost just as detailed as the professional versions. I'm just going to go back to that one. A couple things, though, that are very helpful here for consumers is this first section that's highlights of prescribing information. So this is kind of like a good one-stop overview that summarizes the information in the rest of the list. So the dosage information, the dosage forms, adverse effects, etc. Further down also is a medication guide, which also can be very helpful for consumers. And then, of course, if you want any of this detailed information on the clinical studies, overdose information, you can find that here as well. There's usually a link up here at the top for a medication guide. You can select the HTML version and print that for yourself. And you can also open up the drug label information. Over on the left, there's columns that have additional information. So you can look at the FDA safety recalls, for example. But I'm going to take a quick look at this related resources section. There's a link that goes to Medline Plus, and we're going to look at Medline Plus a little bit more later. But if you go here, it opens up the page for this drug within Medline Plus, which is written for consumers and has a lot of the frequently asked questions that we have about medication. Should we take it with food? What if we forget to take a dose? What are the side effects we can expect? And if there is a warning, there'll be a red box on that page about that drug. And we'll be looking at Medline Plus a little bit more detail later on. Another thing this links to is the clinical trials database. If you're interested in clinical trials, this shows a listing of those that are recruiting, completed, terminated. So this is available to the public to search or to find information about medications that are being studied for certain conditions. And then there's the PubMed link. So if you're not familiar with PubMed, it is a large biomedical database. It's produced by the National Library of Medicine, and it contains the professional medical literature. So it has published study results. So if you need to research further, if you want articles on a specific aspect of your medication, you could click in here, let's say therapeutic use. This brings you into PubMed, which is freely available to the public, and come in here and get a list of articles that you can choose from, read, print out. Some of the articles in here have the full text and some don't. So just something to be aware of. If an article doesn't have the full text and you need it, if you're a state employee or Thomas Edison staff member or student, you can request those articles through the state library through our ILLiad system, which is our online request system. Okay, so that is Daily Med. Another, before we leave the drugs page, I just want to shout out drugs.com. This is a .com, so it does have some advertising on it, but the ads are usually kept to a minimum and they are marked as advertising, but it is a very useful website. It might come up a lot when you're doing Google searches on medication. It has a pill identifier, so you can enter attributes about the medication and what it looks like. There's an interactions checker. There's a pro edition for healthcare professionals. There's also a section for veterinary drugs. There's a symptom checker. You can create a medication record in here. I believe you need to create an account to do that. So it's, it'll be accessed through your password. And I just want to jump to the end of this page and point out, we were talking about, evaluating websites. And so this does show, it does provide information about, this is provided for educational purposes, not medical advice. It shows the data sources it's using, when it was last updated. It shows when its privacy policy was last updated. So this is a website I use a lot as well. Okay. And the information you get on those medication sites, they provide good starting points or overviews, which you can then discuss with your doctor or pharmacist. So moving on to herbal medications or herbal medicines. I'm going to go into the complementary and alternative health tab. There is a site that's been around for many years now from the Memorial Sloan Kettering Cancer Center called About Herbs, Botanicals, and Other Products. So when you go in here, it's also available as an app. I believe this was developed, I think patients were asking about or using herbal or integrative therapies, but this site is good for everyone. So you would go to search in here, there's a link that says search about herbs. And it pulls up this page where you can browse through a list, you can browse alphabetically, or you can search for a herbal medication or remedy. So let's go to the letter H. And this shows you, first of all, I love the illustrations on this site. I love this website. And I've found it very useful for things I've searched for in the past. Let's do a search for honey. And let's say I'm looking for information about Manuka honey. I heard that it's good for wound healing. If we click on that entry, it gives us common names that are used for this. And what I really like about this site is how clear and concise it is. So basically, it gives you sort of the bottom line of the information that's available. And often they'll have like, one or two sentences in bold that kind of summarizes, all the other information. So yes, this may help prevent infections and promote wound healing. And there's different sections you can open to see about purported uses and benefits. There is also a section here for healthcare professionals. So if we open up the clinical summary section, for example, it gives that extra level of information, which is all referenced. So you can see the reference numbers here. Let's say we're interested in this particular topic. We can go down to the reference list and it links to the articles. So we can see here that this goes to PubMed. We can get the article if we need to or request it. And again, we see that the information they provide has links to the peer-reviewed professional medical literature. Okay, so next we're going to take a look at a nutrition website. I'm going to go to the nutrition tab. And at the very bottom of this page is a link to the nutrition source. And this is from the Harvard School of Public Health. This is another site that has been available for many years and continues to provide great information. It's not a website for counting or monitoring calories or, your exercise. It's a place where you find general, it's not like an app like that. It's a place where you can find general information on nutrition topics. And there's a search box at the top right, and you can also browse through a lot of different information. There's news and a wide range of topics on different nutrients, foods, carbs, drinks, diets. It has some pretty good recipes. There's a really nice section on disease prevention and nutrition as related to disease prevention. Let's go into the protein section as an example. So when you go in here, you can see that as you scroll through the information, there are these little sort of like questions, and you can click them and open them to get the answers to specific questions as you go through. It's very useful. Here's the section on research on protein and health as related to diabetes or heart disease, bone health, etc. Also on this page, usually when you go into a page on a topic page, it opens up on the left a column where you can jump to different sections of the website. So let's say, oh, I'm interested in the vitamins and minerals page also. I can come here, go through the vitamins and minerals page, look at the recommended daily intake. And maybe I even want to go further, and there's a column on the right that has links to all the different vitamins and minerals. Maybe I now want information about calcium. So you can really kind of go in and explore the topic. One thing on this website is that it is big. There is a lot here. So sometimes you might have to search the site to find what you're looking for. So let's say I'm looking for information on the keto diet. I can go up to the search box, type in the word keto, and here's a link to their entry on the keto diet. So this goes through and has information about how it works, the diet. Here's a drop-down question on foods that are permitted on the diet, potential pitfalls, the bottom line. And of course, another thing here is that the content here is referenced. So you see it with reference numbers. And again, you can come here, go through the references, and again, go right to the articles. If it's available in full text, you can go right to the articles from this page. Okay, so that is the nutrition source. And I just want to shout out a couple here on, there's a number of really great food and nutrition websites. I really like the New Jersey Department of Agriculture site. They have a link to Jersey Fresh, so you can look for markets, pick your own farms, what's in season in New Jersey. So if after looking at the nutrition site, you want to increase your vegetable consumption, you can come in here and find where to find that in New Jersey. There's also this really great micronutrient information center site. So this gets really sciencey if you really want to see the research, scientific research on vitamins, minerals, and also there's a section here on health and disease. But so this goes into these topics as related to nutrients. Okay. So the next site we're going to talk about covers a very important subject, and that is mental health. So I'm going to go to the mental health tab. And this section of the site is organized into 4 sections. There's general information, specific conditions, a section for finding help, and statistics. So I'm going to go into the National Institute of Mental Health, because this has a good overview of a lot of different topics. So there's the mental health information section, where you can find the topics, help for mental illnesses, statistics, clinical trials. these brochures and fact sheets are really good. You can open up an area, a condition you're interested in, and print out a fact sheet. There's also information for researchers. Maybe you're a researcher looking for funding. You can come here and find what's available. So let's take a look at the health topics section. So here you can select based on a topic or a therapy or a treatment or a special population or a clinical trial that's available. So as an example, let's go into anxiety disorders. And this page gives you, an overview, symptoms. You can jump to the section on therapies. On the right, there's science news. And the publications that are available are also on the right. And also, if you wanted to do a PubMed search for journal articles about anxiety disorders, you can click on that, and again, there'll be a pre-formulated search in PubMed. Let's say we're interested in treatments and therapies. You can just jump down to that section. So this is a really useful site that covers a lot of different topics. Also, the section for help for mental illnesses. They have a link to the new crisis hotline, the 988 Lifeline, that's available throughout the US. Different helplines are available. There's also links to the substance abuse service. And from this, you can find a facility near you. So if you go here, you can enter your location, your zip code, and see what services you can find in your area. The same thing with the behavioral health treatment services locator. You can come in here, enter your zip code or address, and I think it pulls up like a map of services in your location. So really helpful. And so I'm going to close out of that one, and we'll go back here. I do want to do a quick shout out here as well to New Jersey 211, their mental health resources links. So this is specific to New Jersey, and they have links for hotlines, evaluation and intake centers, treatment and counseling. Let's say you're looking for individual counseling. You can come here and search for your area. So you can search by county or by zip code. And then let's say we're looking at Mercer County. You can click on refine, and then it gives you a list of places you can, check to see if this something would be beneficial for what you need. Okay. So the next topic is something that I think a lot of us may find ourselves in the position of needing information about, and that's caregiving. So under the aging tab, there's a lot of different resources here that can help caregivers. But one that I found was really well put together is this Family Caregiver Alliance organization. And this is a place to go for advice and guidance. It has information in multiple languages, and it has advice caring for another or caring for yourself. So if you go in here, you can find information on different topics. There's information on managing specific caregiving tasks. Sometimes there's videos or essays. So it's a place to find advice and support. Also on this site, they have something called CareNav. So if you sign into this, you can sign in and somebody from this organization would contact you and help assist find resources specific to your needs and your location. And this organization is located in California, but they do help people throughout the country. And another thing on this site that I really appreciate is this find services in your state. So if you go here, They've organized certain types of services by state. So if we go to New Jersey, we can come in here and look at the specific organizations and places to find assistance in New Jersey. And again, I really do appreciate when these organizations put together, this information. I'm new to caregiving. Where do I start? There's other places to find information as well, but I found that this one, it presents the information in a really easy to use way. Also, this elder care locator, it's similar. You can search by zip code. It has support information for caregivers, and you can search by a variety of topics that might be appropriate for what caregivers need to, to find out about. Okay, so the last website we're going to look at is Medline Plus, and it covers almost everything. It's a general, comprehensive, authoritative website for consumer health, and it's in the General Health tab. And we saw a little bit of it earlier today. So I read a paper earlier, a recent paper that did a comparison of some of the top health websites that come up when you do a search. And so they use tools like the CRAP test and a few other tools to kind of determine which were the best health websites. And Medline Plus was found to be the most reliable health website that got an excellent rating. And what I like about it is not only the comprehensiveness of the content, but it's clearly laid out. There's information on lots of different health topics. You can browse alphabetically, or you can look by general areas. There's a section for drugs and supplements. Earlier, when we were searching for drugs, we've linked out to this. I'll show you the entry for an over-the-counter medication. This is Tylenol. So again, it gives you a warning box if there's any kind of a warning with a medication, and it lets consumers know like the basic information you need about this drug. They also do have a section for herbs and supplements. So in addition to the Memorial Sloan Kettering site, this is also a very good site that goes out to the National Center for Complementary and Integrative Health, and gives information about the safety of herbal or alternative therapies. There's a section for genetics. So if you need information about a genetic condition, if you're interested in genes or chromosomes, there's a section for medical tests, getting more information about those. The section for videos and tools is good. If you're looking for like a health check tool, there's calculators here, different quizzes. So sometimes those can be nice to use. Also at the bottom, there's a link for easy to read health information. There's links for organization and directories. So this directories link, if you go to this is another place that you can find healthcare professionals by a certain specialty. And in addition, there's this is available, there's information in multiple languages, and there's a link to the clinical trials database. So just to show you what a typical health topics page looks like, I'm just going to go to the letter M, and look for information about migraine. And I'll just scroll down until I see it. So this is your typical health topics page in Medline Plus. They have a table of contents. So then they have the summary. Usually there's a section for start here that leads you to organizations, organizational websites, different tests that might be done for this condition, the section for treatments and therapies that are available, and then other information. There might be specific conditions that are related, that are genetic, that will go to the genetics section. You can click over into the clinical trials database to see what clinical trials are being done in migraine disorders. Again, there's a journal articles section. If we clicked on this, this would go into PubMed. Here you can find information about finding experts on this topic. And I just want to point out over here on the right, there's this box that says medical encyclopedia. I'm going to talk a little bit about that right at the end here. When we're on Medline Plus, we're searching also in this medical encyclopedia. So I think originally this medical encyclopedia, it was called ADAM. It was originally sort of a separate entity. I think, years ago it got absorbed into Medline Plus, but you can sometimes find additional information in here that that is in addition to what you're finding on the in the regular section of Medline Plus. So let me just find the entry for migraine. I'm just going to do a quick search. And one thing that is that the medical encyclopedia is known for is it has these, usually it'll have illustrations, but a lot of times I will find information here that I don't see in the other section. So, and you could, and in that other area in the health topics page, it does link out to here, but just so you're aware that that's what this is. And also, if you were to do a search in Medline Plus, let's say we're looking for information about, let's say I'm going to have a blood test and they're going to do a basic metabolic panel. If you do a search here, you'll see some entries come up. And this first one, this shows that this is in the medical tests section. And then this entry, the second one, is in the medical encyclopedia section. So the medical tests section gives you an overview of the test. And the medical encyclopedia does kind of the same thing. It gives you an overview of the test, but it does have additional information, like it shows the normal values for the test, maybe a little bit more about what the results mean. So I just wanted to point that out, just so you're aware that when you're searching in here, you get that list of information, that list of results. That's what you might be seeing. Some are in the health topics section, some are in the medical encyclopedia section, as well as other areas of Medline Plus. So that is all I have. I hope you found some of this helpful. Obviously, the medical sites don't replace speaking with your own healthcare provider, pharmacist, nurse about your specific situations. But I think they're good starting points. And I think a lot of times when we're searching for medical information, we're going into Google, doing a quick search, and it's good to think about those criteria when we're looking at lists of results there, just to have those in the back of our mind when we're thinking about the reliability of a site. And having a few sites kind of in your toolkit to go to, I hope that that will be helpful for you. So I don't know if anybody has any questions. I can try to answer some if there are any.
Thanks so much, Martha. I really appreciate this talk. I always learn a lot from this. I know I'm a fellow reference librarian like Martha, and it's always good for me to have little subject specialty refreshers like this, so I know some great places to direct people. Everyone, I just reposted in the chat the link to the website that we use very heavily today, which is our Health and Medical Sciences Research Guide, which you can find on the New Jersey State Library's website. And I just resent the handout as well. Again, if anybody has any questions, you can either post in the Q&A and chat. And Martha, my question again, one of the websites that you mentioned early on that's still linked on the research guide was that website that's going away by the end of the year. Could you
Right.
remind us of the name again?
Yes, it is called the Drug Information Portal. It looks like this. It was going to be one of my 8 grade top websites. And then as I was preparing this, I found out that it was going away. But it is available till the end of the year. You know, what's nice about this website is that it links out to a lot of different government and National Library of Medicine web pages. So I think because they're consolidating this into ChemID Plus, that you know, we'll be able to find a lot of that information there. And we'll be able to find this information going directly to, you know, the Medline Plus page, the Daily Med page, the clinical trials pages. So, but this is here until the end of the year if anybody wants to use this.
Okay, wonderful. Juanita, I just posted the handout again in the chat. I can post it one more time. You should just be able to download it right from the chat. If you're talking about one of the handouts that you saw in some point during the presentation, let me know, and then I'll direct that question to Martha. Okay, well, don't worry then, because you'll get a follow-up email, which will include the handout and the class recording. So hopefully by email, you will be able to download it. All right, I don't see any other questions in either the Q&A or the chat. So I'm going to wrap things up. I would like to thank Martha for taking the time today to give us 8+ great health websites. And I want to remind everybody again that there will be a survey at the end of today's class. If you could please take it again, that just helps us to plan our programming for the future. But in the meantime, I want to tell everyone still here to be safe and be well, and we will see you again in our next presentation.
Thanks, everybody. Thank you, Regina, and stay healthy.